This hearing will come to order. Good afternoon. It is my pleasure to convene this afternoon's hearing to assess our nation's progress in combating Alzheimer's disease since the enactment of the National Alzheimer's Project Act, which I co-authored with then-Senator Evan Bayh in 2011. I don't need to tell the people in this room what a devastating disease Alzheimer's is. It exacts a tremendous personal and economic toll on the individual, the family, and our society. In addition to the human suffering it causes, Alzheimer's costs the United States more than $226 billion a year, including $153 billion in costs to Medicare and Medicaid. These costs will skyrocket as the baby boom generation ages. Already our nation's most costly disease, Alzheimer's is projected to cost more than $1.1 trillion in 2050 if nothing is done to change its current trajectory. Alzheimer's is also one of our nation's leading causes of death. The CDC lists Alzheimer's as the 6th leading cause of death overall, and the 5th leading cause of death for those 65 and older. Other estimates put the mortality rate much higher at number 3, right behind cancer and heart disease. Moreover, and most frustrating, Alzheimer's is the only one of our nation's deadliest diseases without an effective means of prevention, treatment, or a cure. It is now estimated that nearly 1 in 2 of the baby boomers reaching age 85 will develop Alzheimer's. As a consequence, chances are that the members of my generation will either be spending our golden years with Alzheimer's or caring for someone who has it. In many ways, Alzheimer's has become the defining disease of this generation. If we are to prevent Alzheimer's from becoming the defining disease of the next generation, it is imperative that we dramatically increase our investment in Alzheimer's research. Just take a look at this chart. At a time when the United States is spending an astonishing $226 billion a year to care for people with Alzheimer's, we are spending less than 0.3% of that amount, less than $600 million a year on research. And believe it or not, that's an increase that many of us have worked for. You can barely see the expenditure level on that chart. Alzheimer's receives funding that is clearly disproportionately low compared to its human and economic toll. Look at the second chart. We currently spend $5.4 billion a year for cancer research, $3 billion a year for research on HIV/AIDS, and $2 billion for cardiovascular research, all investments that have paid dividends. These investments in research for other diseases have yielded tremendous results. Patients have access to new treatments. Death rates for some diseases are decreasing. Yet at the same time, mortality due to Alzheimer's is escalating dramatically. Surely we can do more for Alzheimer's and other diseases of dementia, given their tremendous human and economic price. Fortunately, there is promising research that holds hope for Alzheimer's patients and their families. The research community is poised to make important advances through clinical trials and investigating new therapeutic targets. But adequate funding is critical to advance this research. The National Plan to Address Alzheimer's Disease has as its primary goal to prevent and effectively treat Alzheimer's disease by 2025. To meet that goal, the chairman of the Advisory Committee on Alzheimer's Research, Care, and Services, Dr. Ron Peterson, whom we will hear from shortly, told our committee last Congress that we will need to devote at least $2 billion a year to Alzheimer's research. Well, at first blush, that may seem like a lot of money, but when you compare it to that $226 billion that we're spending caring for people with Alzheimer's, it's less than 1%. And that's the context that we need to put it in. And that's why I've introduced a resolution with several of my colleagues stating that the Senate will strive to double the amount of funding that our country spends on Alzheimer's in fiscal year 2016 and develop a plan to meet the target of $2 billion over the next 5 years. This afternoon, or perhaps tomorrow, the budget is on the floor today. I also will be offering an amendment to the budget, which I'm pleased to say is co-sponsored by my ranking member, Senator McCaskill, as well as Senator Warner, Senator Toomey, and Senator Manchin. And we will also be calling on the budget to reflect that kind of investment. This is an investment that we simply must make to alleviate suffering and to prevent our healthcare programs from going bankrupt. I want to acknowledge all of the advocates who are here today from all over the country. We need your help. We need you to educate members of Congress, and we hope that your presence today will be a powerful statement to all of our colleagues that they too need to help us solve this devastating disease. Senator McCaskill.